So, traumas in the Xray room, trauma 1, trauma 2. So, if you're new to the field, it can be intimidating, I'm not gonna lie, especially once you're finally on your own, you're certified, you're by yourself in the trauma room, someone comes in, GSW, gunshot, or whatever. I could say now, being someone who's been doing it for 4 years compared to being a student, because there's times when we have students and I see them and it reminded me of when I was a student and I could see them nervously not wanting to do it. And then in deep in my mind, I'm like, Miguel, you've been conditioned to see so much stuff that regardless of what the patient's saying, what's going on, because sometimes it'll look like Grey's Anatomy in there, and you're just there, like in your brain, you're like, the doctor ordered a chest X-ray, a femur, right? And you're like, okay. You look at the patient, you hope to God there's a trauma stretcher, and then you're like, okay, this is how I can do it. And then I'm like almost a robotic. Regardless of the yelling and all the stuff that's going on, I'm just there thinking how to get it done. And I'm just like zoning out and just thinking of what I got to do to get it done. Obviously, there's like some level of empathy and some level of like understanding, the patient of what's going on. But at times, you just got to get the image done so they can save the patient, depending on what's going on. Because like a pneumo or anything major that can like kill the patient, sometimes it's like we're just gonna have to get it done. I know it hurts and I know it sucks, but like we gotta get this done so they can save you. Like at times you can sound like you're being mean and you're being pushy, but like there's times where you just gotta get it done. It is pretty hard sometimes, especially on certain patients. But overall, you try to do your best patient care, but like sometimes it is a little rough on the patients.